I'm going to focus primarily on anxiety and depression in MS. Of course, there are other things that folks can struggle with, but this will be the main focus. So I hope what we can do is kind of explore those mood changes, maybe think about why it's so important to even talk about them. We'll go through some of the research that shows what can help people, both professional and what you can do on your own if you're struggling with anxiety or depression. And then I'm going to weave in a little bit of a story of an actual patient. We'll call her Karen. And this patient, of course, she did give me her permission to share this. So I'm also very grateful for that as well. So before I even go into anxiety and depression, I want to talk a little bit about adjustment. I'm sure everybody in this room has experienced the emotional challenges that come from adjusting to MS, a chronic condition. So when we think about adjustment, like I said, these are the emotional and behavioral changes that come to a stressor, such as being newly diagnosed, having a relapse, struggling with changes in abilities, and lots of other life stressors that may or may not have anything to do with MS. Individuals that are adjusting can experience changes in their mood. They can feel depressed, sad, irritable, and angry. They may also feel a lot of anxiety and worry and fear about the future, about what's happening to them. And for some folks, they move through this adjustment pretty quickly. Others, it takes a long time, months, years, and it can certainly have impacts in their daily functioning at work, at school, within their family. Another common experience is grief. Grief is the overwhelming and powerful emotional experience we have when we lose something, a person, a thing, and I'm sure many folks have also experienced grief with MS. So for some folks, this may be the loss of a job. It may be grieving the loss of a life that they thought they were going to have, or the perception that they've lost that life. And again, lots of other things that people can lose, whether or not it has anything to do with MS. Grief is normal and natural when we lose things that we care about. And it includes a whole range of emotions, from denying it, not wanting to believe that it's actually happening, to feeling tremendously sad and angry about the loss, wanting to bargain and try to find some way to make it not true, and then hopefully to a point of acceptance. So I'll go into anxiety and depression now. When we think about anxiety, anxiety is a fear or a worry about what could happen, what might happen, okay? And there's a lot of different symptoms that people experience. Worry, feeling afraid, feeling very restless, which can interfere with sleep, difficulties concentrating and thinking, feeling irritable, and of course, feeling fatigued. When people are anxious, they often engage in behaviors to avoid the things that make them anxious, right? So just thinking of someone's story who feels anxiety about injecting Copaxone, right? And the person shared that they do this whole list of other things before they even inject. They go run errands, they go do laundry, and they do all of this because they're so afraid of injecting a medicine. Okay. So we all feel anxious about different things in life. The challenge comes in, or the problem comes in, when that anxiety really starts to interfere with the quality of our life, when it gets in the way of work, makes our relationships more challenging. So similarly, a lot of folks experience depression. And here's some of the symptoms of depression. So in order to have depression, someone either has to have a depressed or a low mood, or a loss of interest or pleasure in activities. You can also have both of those. People can gain or lose weight, sleep too much or too little. They can feel restless, or conversely have a sense that they're slowing down, they're feeling sluggish. Individuals often experience fatigue or a general loss of energy. Some folks struggle with feelings of guilt, worthlessness, can have trouble thinking and concentrating. And some folks even think about death, whether that's just death in general or having thoughts about harming themselves, killing themselves, or even acting on those thoughts. So, depression can happen in a short time. If we think about someone who has a major depressive episode, that's like a 2-week or longer period where they have multiple symptoms here and it's impacting their life. But some individuals also experience depressive symptoms over months and years, a more persistent depressive type of disorder. And again, there doesn't necessarily have to be a reason for the depression. It can be MS related or not. So I'll speak a little bit about Karen. So Karen is a 60-year-old woman. She was referred to me for anxiety and depression. Karen's been diagnosed with MS for many years, and she has trouble ambulating. She uses a walker. She struggles with pain, fatigue, spasticity issues. And, when Karen first came to see me, she explained that her MS was so bad that she couldn't leave the house. And that's not because she couldn't drive. It's not because she couldn't walk. It's because she was so afraid of what would happen if she left the home, that she might fall. And beyond the falling, she wasn't actually afraid of getting hurt. What she was afraid of is what people would think of her. Would people make fun of her? Would they take pity on her? How would people respond? So she didn't leave the house a lot, kind of just when she needed to. And it was quick trips to the store, wherever she needed to go. When she would come for appointments, she wouldn't really talk to anybody in the waiting room. She looked a little afraid to be there, actually. She also struggled with depression. She felt pretty hopeless having MS, and about her ability to contribute in any meaningful way to anything around her. So she spent a lot of time in bed, and pretty much the only folks she saw would be family members. Like the rest of us, Karen also had a lot of other struggles in life, right? So whether it's family stressors or other things that have nothing to do with MS, but just pile on more stress and difficulty. So we talked a little bit about what is anxiety, what is depression, what are some of these mood changes, and it's extremely important that we do talk about these things. And I hope if you walk away with one thing, it's that there's no shame in bringing up these issues when you come to visit us or your provider, whoever that may be. So what we know is that in the MS population, 20 to 50% of individuals will experience depression in their lifetime. So if you look around the room, that's a quarter to half of the people that are attending today. That's pretty significant. We also know that individuals with MS are more than 2 times as likely to attempt suicide and almost 2 times as likely to complete suicide. When it comes to anxiety, in the general population, only about 5% of people will have a generalized anxiety disorder, but within the MS population, that's 20%. So a much higher risk of experiencing anxiety. Life is probably hard enough. It has a lot of challenges anyway, right? But mood disturbances make life harder for everybody. It makes life harder for folks struggling with chronic diseases. So when we're feeling depressed and anxious, it can be hard, like for Karen, it can be hard to keep appointments, to take medicines like we're supposed to. It can be hard to even want to get out of bed and shower, brush our hair, do those things that we need to do to get the day started. It can add stress to our relationships, whether that's at work, whether that's with our family or friends. And mood disturbances can affect symptoms that individuals with MS are already struggling with. So challenges with cognition or brain fog, sleep disturbances, fatigue. It can just make all of that worse. Another reason it's important to talk about mood issues is that you may be taking medications that impact your mood, and your doctors need to know this. So steroids, which many folks are prescribed when they experience a relapse, steroids can contribute to a sense of mild euphoria or well-being, which may be great, but it can also lead to some anxiety. And for folks that are on it for longer periods of time, some can experience depression. For products like Avonex and Rebif, data shows that greater than 10% of people can experience fatigue or depression. For Provigil, numbers aren't as high, but individuals can still have anxiety, depression, nervousness. And then lastly, I know not really related to anxiety or depression, but baclofen, which is prescribed for spasticity, should be prescribed with caution to individuals that have psychotic disorders. And this is just a list of meds that may be common within the MS population, but there's a whole host of other medicines that folks can take for other conditions that may have similar effects. So just good to talk about these things with the provider. So another important point I hope you walk away with is that help is available, whether that's professional help, which we certainly recommend, or whether that's things you can do on your own at home with your friends and family. So the first thing is counseling or therapy with a licensed clinician. There are many people in this community, whether or not they work directly with the MS population. There are many skilled therapists. I'm just thinking of folks offhand within the Ochsner system who work with many of our folks, and I've heard patients really say they've gotten a lot out of that. So working with a licensed therapist, just a little bit of information here. So there's many types of therapy, many models of therapy out there. One that has been studied extensively, not just with the MS population, but with the general population, is cognitive behavior therapy. And the focus of cognitive behavior therapy is to really help a person to examine how their thoughts, typically their unhelpful thoughts, how those things contribute to mood and emotions, and then have an effect on behaviors, okay? So the goal is to explore those thoughts and to try to challenge them to have a positive effect on mood and behavior. Psychoeducation is really the provision of information and resources in order to help someone solve problems, okay? To be able to solve problems and cope better with the condition. I know folks probably already take many medications, but there are medicines to help with depression and anxiety and other mood conditions. You can have these discussions with a psychiatrist, with your neurologist, with your primary care physician. There's many options available: Lexapro, Prozac, Wellbutrin. There's so many, and so that could be a possible source of help. And of course, what I often hear from individuals is concerns about side effects. So those are real. And again, just talk openly about your concerns, what you're worried about, weight gain or sexual side effects. Just talk openly about that. So here's something that you may or may not really need to even see a professional for. So there's a lot of research into exercise, just exercise in general, and the positive effect it has on our mood and our sense of well-being. Okay, so I'm just going to share the results of a few studies. And these are all studies specifically within the MS population. So there's one study done where individuals engaged in just one bout, one 30-minute bout of either treadmill walking or yoga. They took a mood scale before and after, and mood improved, just that one bout of exercise. There's a lot of research into yoga, and of course yoga has many physical benefits for individuals, again, whether they have MS or not. But within the MS population, studies of yoga have shown to reduce depression, to lower levels of stress, and to improve individuals' sense of, quality of life. Another study looking at yoga and aquatic exercise, again, lower levels of depression, decreased fatigue, and less paresthesia. I was curious, I feel like sometimes there's a sense that you can only do yoga or you can only swim in a pool, right? But that's not the case. Folks with MS can engage in any type of exercise as long as it's catered to their specific needs and capabilities. So of course there's folks that lift heavy weights, run marathons, do the bike MS, all these types of things. So there's another study that showed that high intensity resistance training helped improve measures of mood, again, improved health-related quality of life, and fatigue as well. So the message is exercise. Do whatever you can, whatever works for you, whatever you enjoy. And you can, of course, seek out guidance from your physician, from a physical therapist who can help cater an exercise program to your capabilities and what you're able to do. Another topic or area of research is in mindfulness. I don't know if folks have heard of mindfulness, maybe even mindfulness-based stress reduction. This is kind of training in a couple of different things. So meditation, breath work, yoga postures, very easy, simple yoga postures, and overall self-reflection and awareness. And it's kind of about helping us to be present in the moment, experiencing life now without judgment, without a sense that we have to urgently change that. And so there's a lot of research going on in mindfulness right now, but there's also research with the MS population. And there's a whole review of all these different mindfulness-based interventions, and what they found was significant improvements in quality of life and significant reductions in anxiety and depression. So generally speaking, the more mindful individuals are, the more they practice mindfulness day to day, the less they perceive stress in their life, they cope better, and all of this was regardless of age, sex, education level, the type of MS they have, the type of treatment they're getting. So across the board, there's improvements. So just quickly, back to Karen. So what did Karen do to help with her anxiety and depression? Well, she got enrolled in therapy, obviously. She's still seeing me. She worked initially with the neurology team and then with a psychiatrist to find a medication to help her. And that hasn't been an easy journey. It wasn't, an instant fix. She had to tweak the dose, but she's doing that. She got engaged in physical therapy and created a home exercise program. And she also joined one of the yoga classes. So kind of wrapping up here, all of these, especially therapy and mindfulness, these treatments really aim at helping to build our capacity for and our skills of resilience. So resilience, very simply said, is our ability to bounce back from difficult things, our ability to adapt well in the face of adversity. And I'm sure some of you think, well, that's just not me. That some people are born with that, but not me. But that's actually not true. Research has shown that we can teach people the traits and the skills to become more resilient in the face of adversity. So here are some of the skills. So one, learning to make realistic plans and taking those steps to achieve them. That's a skill of resilience. Learning to identify and nurture your own strengths and capabilities and capacities, finding those things that you're really good at and engaging in them, and that helps build confidence. Another skill of resilience is effective communication, healthy communication, and problem solving, and learning how to manage strong feelings and impulses. Okay, so these are all skills that we can all learn and get better in. So finally, Karen, I just want to talk a little bit about her resilience and how she's doing. So Karen is still involved in therapy. She is not cured of her anxiety or her depression. She has tough days, but she is leaving the home much more frequently. And not only is she leaving the home, but when she goes out, she's engaging with people. When I go see her in the waiting room, she's talking, she's smiling, she's happy to meet people. She's shared stories of going out in public, and before she knows it, she's sitting next to a family member of someone who has MS, and she's giving them advice. And so she feels like she has something to contribute now. She's also learning to set some healthy boundaries and limits with people in her life that don't help her cope well or that don't really support her. So that's also important. And I think what I enjoy most is that, she still has challenges and stressors that pop up. In fact, she's got some problems at home right now with things breaking down, and she's been really sick, and her fatigue's been worse. And that scares her. But it's so wonderful to hear her kind of talk through those unhelpful thoughts. And then, before I know it, she's laughing, and she's like, I'm going to get through this. So that's really positive.